So continuing on with the discussion on the cardiovascular system, we look at the blood. When we look at blood, there's some things we want to take into consideration. We want to look at the cells that circulate throughout the cardiovascular system within the blood. We're going to look at blood pressure. So we kind of all know that we have blood pressure. We get our blood pressure measured, but the purpose of blood pressure is basically to maintain pressure of the blood against the arterial walls, and it helps for the oxygen perfusion. So we know that blood circulates throughout our body to carry oxygen and nutrients, and that's really what the blood pressure allows for. The different types of blood cells that we're looking at, we have our red blood cells, also known as your erythrocytes. They are blood cells responsible for transporting oxygen and removing carbon dioxide. You have your white blood cells, which we talked a little bit about previously. They would be your lymphocytes. Okay, so they're responsible for mediating the immune response. We talked about the concept of phagocytosis and how the white blood cells help to remove debris and foreign substances. And you have your platelets, or your thrombocytes. They're responsible for the clotting mechanism. So table 6.1 in your textbook does sort of summarize all of that. And the other table I want you to look at, as noted up top, is table 6.2 on blood pressure. So what that table looks at is, when certain things happen in the body with the cardiovascular system, how that affects your blood pressure. So for instance, if for some reason blood volume were to decrease significantly, and this would make sense. So someone has a massive wound, or they severed an artery. Obviously, if the blood volume would decrease, the amount of pressure in the system would decrease as well. If, for instance, or another situation would be what's called widespread vasodilation, where the diameter of the blood vessels increase. If you're doing that, you're obviously going to be reducing the amount of pressure being able to be exerted by the blood on the arterial walls. So make sure that you review that table to see the different effects, and you could also see the certain things that cause an increase in blood pressure. So looking at the cardiovascular system and exercise, so a question that I kind of want you to answer: what happens to the heart rate as you exercise? So, and I think that's something that we pretty much all know what goes on. But when you go to partake, not only while you exercise, but just even in preparation for exercise, or just the thought of doing something very physically active, what happens with the heart rate? Another adaptation to consider is in looking at the cardiovascular system in response to different types of exercise. So what you have with aerobic versus resistance exercise, so someone who highly trains in aerobic exercise versus resistance exercise. So what happens is the ventricular mass and volume increases in response to aerobic exercise. So in other words, the actual size of the inside of the ventricle will actually increase in size. This is different as opposed to what happens with resistance exercise, which actually increases the muscle mass of the ventricle. Okay, so the actual thickness of the wall will actually get bigger with resistance exercise, whereas the inside region, that the volume will actually increase as a result of aerobic exercise. So make sure you can understand the difference in as far as what happens with the actual structure of the heart. And obviously, when a lot of people exercise, they kind of do a combination of both to kind of balance that out. But it's important to know the difference between those two adaptations. So looking at pre-participation screening, so one of the things that is obviously a major concern in athletics is sudden cardiac death. So part of the purpose of having pre-participation screening is to hopefully screen people out who may have some pre-existing issues that could possibly cause problems. So we want to kind of know about pre-participation screening, or what really needs to be included. So as recommended by the 36th Bethesda conference, and your textbook talks about this, the American College of Cardiology, they basically have listed the minimal components that need to be included in a pre-participation physical exam. So the table in your book has 3 major components and then things that need to be listed underneath this. So the 3 main things are you need a family medical history, you need a personal history, and you need the physical exam. Are what really need. And there's things within that I need you to take a look at in that table. But the family medical history, personal history, and a physical exam, and what's kind of included in each one of those. There are questionnaires that are also endorsed to be a part of this. Again, just to kind of further make the history much more complete. It's also recommended that there be, at the very least, auscultation or listening of the heart and lung sounds as a part of the pre-participation physical exam. There's some discussion as to whether or not you really need to do some of the we're going to talk about diagnostic tests, the ECGs and the echocardiograms. Right now, really, they're just looked at as follow-up options if something comes up in those basic components. There is some debate as to whether or not they should be included, but as of right now, they are not included in the pre-participation physical exam. The other diagnostic tests are just mainly used for follow-up purposes. So these are some of the main diagnostic tests talk about the ECG and the echocardiogram. So we're going to talk about the ECG first. So if you look at the one picture there with the little waves, that is a recording from, again, what's known as an ECG or an electrocardiogram. So the ECG basically looks at detecting the electrical activity of the heart. So it's looking at basically how functional the heart's electrical conductive system is actually working. So if you see there, you notice the letters, you see P, Q, R, S, T, and those different areas represent different functions of the heart. So ideally, when you're looking at, that's pretty much what an ideal ECG would look like. So kind of go through some of the parts. So the P wave is for atrial depolarization. The QRS complex is ventricular depolarization. And that also, as your book describes, it hides atrial repolarization. And the T wave is ventricular repolarization. So those are the parts that I want you to see and be able to understand. So I should be able to ask you what each one of those different parts of the wave represent. The echocardiogram is a different type of diagnostic test that actually looks at the structure of the heart. So it actually gives you an image. If you look on the picture, you can see the individual getting the echocardiogram done, and the little black picture sort of kind of looks almost like, I guess to compare it if you haven't seen anything like this, sort of like similar to like an MRI type image, but it's looking at the heart, and it uses ultrasound energy in order to do that. So one of the big things that this could kind of possibly pick up is something like hypertrophic cardiomyopathy, which is a condition that we're going to be discussing later on. So it looks at the structure of the heart, it looks at the size of the ventricles, it looks at the thickness of the muscular wall in the heart, and just kind of gives a visual. And again, if you look at the picture, you can actually see, again, you can see what the actual echo looks like, and then the picture of the heart is kind of showing you what the echo is showing you. So it kind of gives you a little bit of an idea as far as what you'd see with this type of test. So getting into kind of general signs and symptoms of cardiovascular pathology, again, probably one of the biggest ones that always comes out and people think of is chest pain. So I'd like you to take a look at the algorithm in your textbook, because again, chest pain can be something very benign. I mean, typically when you're looking at younger people that have chest pain, a lot of times it's not cardiovascular related. Again, there's a lot of structural things orthopedically. For instance, a lot of young people get pain referred to their chest from some sort of injury or pathology to the thoracic spine. But again, we want to make sure that we don't miss things. And again, that algorithm that kind of goes through showing you like what other symptoms or what other things that you want to look for in conjunction with chest pain and what that's going to mean. Obviously, when we look at chest pain of cardiac pathology, we look at things on the left side of the chest, the neck, the shoulder, the arm, and usually what you see is the pressure that somebody has usually worsens with exertion. So, people say that as they were running or whatever, their chest pain started to get worse and worse. Dypsnea, again, dypsnea is difficulty breathing. Now, again, so here's where your connection between the cardiovascular and the pulmonary system comes in, which is good that we talk about both of these systems kind of together in one kind of testing session. But difficulty breathing can be caused by that as well. So as cardiac output decreases, it makes it harder and harder for people to breathe. So again, usually what you see with this is that individuals with dypsnea related to cardiovascular issues, the dypsnea will improve with rest and it will worsen with activity. The other thing is cardiac-related dypsnea is usually unaffected by posture, whereas a lot of times people who have pulmonary causes of dypsnea will usually have that kind of related to their posture, kind of how they're positioned. Fatigue is another general sign and symptom. Again, if there's some issue with the cardiovascular system, there's going to be less blood delivered to the rest of the body. If there's less blood being delivered to the rest of the body, there's less oxygen. So it kind of makes sense. So people will typically feel fatigued when you're discussing cardiovascular signs and symptoms. And then palpitations. Palpitations are basically, people will describe them as skipped beats or a fluttering heart. Usually are very uncomfortable for the person, and usually this is usually indicative of somebody that has some type of cardiac conduction disorder. And again, you usually would want to see if someone has this. Do they have any other major signs and symptoms? Do they have a lot of chest pain? Do they have fatigue? Do they have dypsnea? Are those other things that they have in connection with that? Because that could be a bit more of a serious situation. Syncope or fainting is another one. There's basically 3 typical causes of cardiovascular syncope or fainting. Peripheral vasodilation or orthostatic syncope. So again, when you talk about the idea of blood vessels dilating versus constricting. So if you see a blood vessel, when a blood vessel dilates, that means the inside diameter gets bigger. When it constricts, that means it gets smaller. So if for some reason there is some widespread vasodilation, again, it's going to cause decreased oxygen perfusion, drop in blood pressure, which we had talked about earlier. Increased intracranial pressure from bleeding. So somebody who has suffered some sort of head trauma and they have bleeding there, that could cause syncope as well. And any acute reduction in cardiac output. So if there is, for some reason, a decrease in the amount of blood getting pumped throughout the body, again, there will be some syncope involved with that. Usually a sudden drop in cardiac output, something will be causing it that is a little more serious, something such as a heart attack. And another sign and symptom is claudication, and this is something involving the circulation to the lower limbs. So what people who have claudication, if they have some type of insufficient circulation to their lower extremity, they'll complain of like a cramping and aching type of pain in the lower legs. Some other things to look at: skin, nail temperature, color, and appearance. So looking at skin color and temperature, you could be looking at, typically individuals who have some type of circulation issue, be it something it could be involving the blood vessels directly. So people a lot of times could possibly get like cool, clammy skin. They can also get hot, red skin. So for instance, if the blood vessels constrict, they can get like that cool, clammy type of skin, or if the blood vessels are dilating for some reason, the skin can start to feel a lot more warm. Again, color-wise, They could be pale from vasoconstriction or low blood pressure. They can be bright red from if the blood vessels are dilated or hypertension. You may also even get like a blue or black color or blue or purple color in the skin from possibly lack of oxygen in the area. So that's something to be mindful of as well. Paresthesia, or the kind of numbness and tingling. So if the nerves in the area are getting deprived of blood, that can also cause the numbness and tingling sensation. And edema. So edema is any type of accumulation of fluid in the interstitial space. So this could happen, again, if there's some type of obstruction, particularly in the lymph vessels or the veins. Any type of cardiac failure, which again typically isn't something you'll see in a younger population, but an individual with cardiac failure will develop kind of a more generalized edema kind of throughout their body. Whereas if somebody has a strict vascular obstruction, what you're usually going to see is edema forming distal to the obstruction because of the fluid buildup that's going to occur in the area.